Hey everyone, I'm Liam with Reach Out and Read Minnesota, and I'm here with Dr. Gigi Chawla, Chief of General Pediatrics at Children's Minnesota and Medical Director for Reach Out and Read Minnesota. And we're here to talk a little bit about one of our favorite things in the world, books. And specifically, we want to talk a little bit about why children's healthcare providers all across the state are giving out brand new books at well child visits. So, Dr. Gigi, my first question for you. Typically, when we think of a checkup, we're thinking of stethoscopes, shots, immunizations, stick out your tongue and say, ah, right? But we might not think about children's books, right? So, why are children's books becoming such a big part of the well child visit for young children?
Well, I think what I really want families to know is that the nature of a well child visit is about preventative health and preventative health care. When we think about stethoscopes and other things, it oftentimes is when kids are sick. But preventative care is really what pediatrics is all about. And in doing that, we really want to stress things that are important as literacy and child development and things like books and encouraging the reading between parents and caregivers and children really promotes bonding, mental health, and sets kids up for a full lifetime of learning.
That's so cool. It's about caring for the whole child. So what when you're handing that book over to the child, what kinds of things are you saying to that parent or caregiver?
Yeah, when I hand a book over, it's really, really interesting. When you're actually in the exam room and you hand a book to a child, there are so many things that we're looking at. The first is just how do they use their hands? How do they use their hands to reach for that book? What do they do with two hands in turning the pages? How do they point to things, track with their eyes, and then things like the content of the material that's in the book and the learning become the next portions of the things that we look at. When you can really see that a child has been using books in their own home and learning, you can also see that when a child gets a book and they turn the pages and they're looking at things, that they will look back at their parent for verifying what they're seeing and what they're learning. That is a really important piece of what books are all about because that's something that we call medically serving and volleying, which is how kids learn. They try something and then they make sure that what they tried is the right thing, the right next step. And so that learning process is what I try to teach families about how important it is just to help kids learn anything, whether it's about reading, whether it's about what the pictures are, or the sentiments that the book is trying to teach, sad, happy, anything like that, or learning to ride a bike, that the kids are. They try something and they look back and they make sure that they're doing the right thing. So, helping families understand that process and what learning looks like through something as simple as a book is exactly what Reach Out and Read is all about.
Wow, that's so cool. Um, but talking about books, we know that not every parent, not every caregiver might feel comfortable with reading themselves. Maybe they didn't grow up having books around them or aren't quite sure how to share a book with the child. What kind of guidance would you give parents like that?
Yeah, that is such a good question. And really, it is about the act of sharing something with your child, right? Getting in a nice, cozy position, sharing the pictures, and finding things together, whether you use the words or you don't use the words. And what a book is wonderful about is making your imagination come to life also. So it doesn't honestly matter what the words say. You
Mhm.
can tell a story to your child without even using the words at all. In fact, some of the best reading really comes from using your imagination and pictures alone. That's how kids really learn. And so I think that is, the most important thing from my standpoint is repetition, imagination, and bonding with your child in that time to make sure that they know how important it is to you to help them learn.
Yeah, that's so sweet. It's just those moments of being together that really count. Can you tell us about a time when you've used the Reach Out and Read program, you've shared a book with a child at a well child visit, and it really made a difference?
Yes. I can tell you about a time that I actually really learned something. Um,
Mm,
and so in Reach Out and Read, we use books that show the main characters to be windows and doors of our patients and families so that kids can see themselves, a little brown boy or a little brown girl, as the lead characters in books, and can help spark their imagination and make sure that they know that they can be anything that they want to be.
mm,
um, but I in a clinic visit, I once gave um, a white family, a Caucasian family, a book with a Caucasian child as the lead character.
mhm,
And that child accepted the book and started to turn the pages. And mom was very disappointed. And she handed that book back to me and said, I actually want you to challenge my child with characters that expand their knowledge base too. Please give me a book. Please give my child a book that has characters that are diverse as the community we live in.
mm,
And that to me was such a good wake-up call because parents of all creeds, diversity, they
mhm.
all wanna learn. They don't just only want to see kids in books that look like themselves, and so that was a real learning for me too, that books are not just windows and doors, but books are opportunities for all of us to, expand our definition of diversity and to continue to learn.
Yeah, that's so great. Even at the youngest age, we can learn so much from books and bring us into and show us new worlds. Lastly, Dr. Gigi, so if a parent or caregiver wants to be receiving these books at their well child visit, um, what should they be doing?
Well, first of all, I hope they already are receiving
Mm.
books. We have books in Reach Out and Read Minnesota in 307 clinics across the state. So you should already be getting a book at your well child check. But if you are not, Liam, what would you suggest that families do?
Well, if they want to find a clinic that does participate in Reach Out and Read Minnesota already, what they can do is they can log onto our website, reachoutandreadmn.org, and find our clinic map. And so we have a map all across the state with different clinic sites that are participating. Otherwise, they should just ask their clinic and see, is it possible? Could we start participating in this program?
We want every clinic in the state of Minnesota, so we might need your help to get there.
We'd love that. Well, thank you so much for taking some time to talk with us today, Dr. Gigi.
Thanks for having me.